my name is Heidi Mon. I'm a registered nurse, but I'm the pathway lead for health sciences here at the Epic campus. Our health sciences program has 3 different pathways embedded into the program. So we have a certified nursing assistant program where students can get their CNA upon graduation as long as they pass the state exam. We have a sports medicine program where students can become certified personal trainers. They get a NASM personal training certificate. And then we also have a behavioral health program. We are the only high school program in the state of Colorado that has a registered behavior technician program, or an RBT. That's a certification those students will be able to learn and go into some really high demand jobs right out of high school. Epic was the first high school program that we're aware of in Colorado that actually has multiple anatomage tables. So we're really excited to have that here. Our anatomage tables are unique because it provides students really a hands-on experience to work with real cadavers. Students are able to see all of the different anatomy from skin, muscles, and skeletal, and all of the different body systems. And they're able to interact with them and really see it from a real-life perspective before we actually take them to a cadaver lab towards the end of this semester. Our Nurse Aide program requires that students go out and do 60 clinical hours during this semester. We go to memory care, acute care, and long-term care facilities. Students get experience in all of those facilities, working with CNAs, nurses, patients, doctors, right? All people involved in healthcare. Our sports medicine students are going to be doing some shadowing. They're going to be going out looking at some different sports medicine facilities, different kinds of training facilities, seeing what personal trainers do. And our registered behavior technician students go out and work with children that have special needs or children that have autism, and they are learning what it takes to be an RBT and how to work in that arena with those children. Credits that students earn here in the health sciences pathway, they can earn science credit, language arts credit, PE credit, as well as general elective credits. If you have any interest in healthcare, we have a place for you. We have a lot of fun. We have a lot of hands-on activities. We go on a lot of work site tours. We are working on getting some shadowing opportunities for students to really get into the real world to see what it's like to be in healthcare. I think my best advice for parents is let your kids explore. I think probably 80% of the students that have been through my program in the past have gone on to post-secondary opportunities and really pursued a career in healthcare. It's a great opportunity for them to meet some new kids from other schools. It's a great opportunity to work with different staff and try different things in a classroom that they won't normally get at their home high school. After being here a year, we are quickly learning that students love being here. They love the camaraderie. They love working with students from other schools. They've got some freedoms here that they don't normally have at their home high school. And so kids are thriving. We just have found that students really feel welcome here and they love being here. So why not?
I chose this health sciences pathway just because I really want to help people, and it'd be a really good way to get into like medical field and to see if I really actually want to work in there. Coming into the pathway, I expected I'd always be doing schoolwork and that everyone would be like trying really hard to like get all the coursework done, but my expectations were kind of reversed. It wasn't as much classwork, but it was more application of the content. In the future, I'll definitely be impacted by Epic because I started way earlier into the field and you get certified, which being certified gives me the opportunity to get a job and to get more career experience and to grow. We have a lot of off-campus field trips, so it's been really amazing to like actually go in to see job shadows and to see people working and understand what their job is really like on a day-to-day basis. I did not expect that it would be so out in the field. Some advice I'd give to like incoming Epic students would be very open-minded, be ready for change, and be super flexible, because being willing to learn different things and also respecting your teachers because they're all very helpful in the broad spectrum of life.
My name is Ariel Riondo. I am the program manager for the neurobehavioral program here at Craig Hospital. Part of our mission here at Craig is to make sure that our individuals, when they leave the hospital setting, have a community that really understands them well and can support them. In terms of the student experience, it has been really great to see young people get excited about things they didn't know existed. I have spent an immense amount of time at the Epic campus in the past year, and just watching the enthusiasm, the excitement of the children, and really seeing them start to incorporate our lessons into their life has been inspiring for me as a clinician. The healthcare pathway has been really unique this year because we did open up the behavioral science pathway. We have also offered our basic education to the CNA pathway and the health science dietary pathway. To see people who at 18 years old have made the decision that maybe they do want to look at health sciences is a very different perspective. So my end goal for them would be early on, they are getting enough education and foundation, and it just becomes that little seed that we can plant to go for the rest of their career. Healthcare needs really great people. They need people who care. They need people who are compassionate. You might feel that it really does fill your cup and it's a meaningful place to be.